So what I'm going to be talking to you about is very timely, I think, because there's a lot of people who have ADD that are undiagnosed and don't know that. And it leads to problems not just for children, but it leads to problem with adults. And I've been very fortunate in one way where I started this field, developed these QEEG brain tests before they were really discovered at all. We kind of worked on the QEEG and found out that we could diagnose more than 90% accuracy ADD. Over the years, we've become more sophisticated and can work on subtypes of ADD and also look at patterns of Asperger's and anxiety. And we started working with children, and now we work with children, adolescents, and adults. So this is very important, especially with the way our school is going now, because most of you, if you're students or you're children, they're going to school on the computer and they're sitting in front of a computer like we are and trying to pay attention and do their homework and socialize. And you as parents have become teachers. So this is really important topic now. But the other thing I'm going to share with you at the beginning, and one of the reasons that's kept me passionate in this field for more than 35 years, is I found out as I got into this field that my brother and sister and family members had ADD and were undiagnosed. I'm just going to tell you about my younger sister. She was diagnosed with dyslexia in the 90s. She was never diagnosed with ADD. She had a hyperactive type. Most girls have the inattentive type. She was very fidgety and hyper, but the reason she wasn't diagnosed is she was a very successful athlete. And lots of kids who have lots of energy and lots of professional athletes have ADHD, and they're really good when they have a lot of energy to expound, but when they have to sit still and do homework or sit in front of a screen like we're doing now all day, it brings out the worst. And as you hear, I call ADD interest deficit disorder. So it shows up when it's very boring. My sister kind of had more complications as she got older, because not only did she get head injuries, but she wanted to get head injuries indirectly because she became a female boxer. And boxing and martial arts are some of the worst things you can do for your brain. So in addition to ADD, she had head injuries and had got a traumatic brain injury and over again. And I was only in my 20s at this time, and she didn't get a good diagnosis until I was able to have her work with a colleague of mine in Florida to get a brain map. And then she improved and she stopped boxing, but it affected her. To this day, she still has attention problems and memory problems and anxiety. So one of the most important things I'm going to talk about today, and this is the reason for it, is that it's always good to get testing now. I kind of call it a no-brainer. There's really no reason not to get your brain tested. I keep hoping, I've been hoping this for 20 years, that this is going to become routine in our society, in our healthcare system. But you know what? I don't think it's going to happen soon, because we can't even agree what to do with the coronavirus. We can't agree on what test and what procedures, and if you still need to wear a mask, and who's going to get the vaccine. So that's what's something that's really urgent. But in our society, 90% of diseases are not treatable with orthodox medical procedures, which are medicines and surgery. And even though we have the best technology system in the world, a lot of times you can see we're unprepared and people disagree, and it leads to chaos. So I would call this, in my opinion, I think this is a healthcare crisis, and you can see it now with coronavirus, but this isn't new. This has been going on since I started practicing 35 years ago. Why do we have a healthcare crisis? Let me tell you the situation now. 1 out of 4 people in our country are on psychiatric medications for ADD, anxiety, depression, sleep. That's even gone up in the last couple months with coronavirus. 1 out of 10 students have ADD, but those are the ones who know it. There's a lot of people who don't know they have ADD. I talked to somebody in their 60s today from back east, and they've never been diagnosed. 1 out of 36 individuals have autism spectrum disorder, ASD, or Asperger's. Anxiety before coronavirus had increased 30% in children, and it's gone up double that since then, especially with them going to school on the internet or going to school in person and having to wear a mask all day, or not knowing how they're going to go to school because it changes pretty much every day. But even though we've had this brain testing, we developed the initial part of this QEEG test called the QEEG scan 30 years ago. Even though we did that, it's still not necessary. Matter of fact, no testing is necessary in our country. There's no testing necessary. You can go to a doctor, get a prescription, and totally have the wrong diagnosis. I see it every day. It's one of the things I'm very passionate about and I want to see improve. So sometimes I almost feel like we're being lied to. I mean, think about all the news with the coronavirus. It changes every day. You know, you want to do plasma or this treatment or that treatment, or you shouldn't get tested or you should get tested. And we need a solution. In ADD and ADHD, the solution is getting a good, accurate testing. Then you know what to do. Then you know options. And we also need a solution that's not going to wear off and cause side effects, because if it wears off or causes side effects, people are going to stop doing it. And we have millions of people in our country that were treated for ADD when they're younger, but now they've stopped as they've gone away to college or are an adult, or their insurance company has stopped paying for it. And in spite of that, if any of you are in the financial area, you know that our healthcare industry is doing very well now, even though a lot of businesses aren't, and that's really important to develop vaccines, but it's just not the good healthcare system that we can have. So let me talk a little bit about ADD. I always get people that are brand new and really are just hearing about that, but some of you may have been on this journey for years and years. So I'll go through this kind of little quickly. ADD or ADHD, everybody were officially supposed to say attention deficit hyperactivity impulsivity disorder. So they shortened it to ADHD, and then you're supposed to say what type they have. But there's 3 characteristics. We call these core characteristics. The first one is inattention. You're distractible, you're daydreaming, you have a hard time being focused at work, or if you're going to school on the internet. You're unorganized, you're easily distracted, you have a hard time following through. For kids and students, that's finishing their homework. And nowadays, our educational system isn't able to really monitor homework being turned in the way it used to be. So it's even harder now because the schools are working on ways for students to be accountable. You lose things, you're forgetful. Losing your keys, your cell phone, losing your homework. The most frustrating thing I hear from students is they complete their homework, but they forget to turn it in. And unless the teacher asks for that, it stays in their backpack or somewhere stuck in one of their books, and then they get a low grade or sometimes even fail. So this is paying sustained attention. You have a hard time with your attention span. This is what I call interest deficit disorder, because this shows up more when you're bored. Impulsivity and impulse control is our second part of ADD. This can be verbal or it can be physical. We may think of things physical. Those of you who are watching the news, there's a lot of impulsivity in our world right now with what's going on with violence. And there's a lot of people that say things and do things very impulsively because they're rightfully upset. But impulsivity can be verbal. Impulsivity can be interrupting, saying things before you've thought them through, having a hard time waiting your turn or waiting in line in traffic. Interrupting is impulsivity. Lots of girls I see aren't physically hyperactive, but they interrupt and they're very talkative. And they may not get disciplined in school. May not be picked up, but these are also signs of impulsivity. Impulsivity is acting before you think. We still think of ADHD as being hyperactivity, and that's kind of more obvious. You're fidgeting in your chair. You can't keep your feet or hands still. You're kind of restless. Now, it's kind of, some of these examples are kind of unusual now because we really can't go to movies anymore. But if you went to a movie theater and you have ADD, you might feel so restless you can't even focus on a movie. You have to get your phone out and look at your phone and fidget with your phone in order to keep your brain awake. You can't turn your brain off. You can't turn your brain off at night and calm down. One of my favorite commercials that has come back now was that Ever Ready Bunny that keeps going and going, and a lot of parents would describe their kids to me like that. They just feel like they are on a wind-up motor. But hyperactivity can be verbal too, talking a lot, moving a lot. And then when you finally sit still, your brain shuts down and you get tired. And you may fall asleep when you have to pay attention. So you can have any three of these in combination: inattention, impulsivity, and hyperactivity in all different degrees. But like I said, I like to call it interest deficit disorder. Now, what about adults? We see more and more adults, and as adults, you might be working remotely, and it's also harder to pay attention for that. So what would symptoms for adults look like? Symptoms for adults might be things that would affect your marriages. You have a hard time listening to your spouse. Your spouse says, let's go ahead and meet somewhere tomorrow at a certain time, and you forget. Your spouse says something really important and you're distracted and you never hear it, and it's something very important to them. You have to remember to pay the bills and you get distracted with what's going on in the news and you forget to pay the bills, and then you get a notice that you're late and a fine. It affects families because this is genetic, and we know that almost all of ADD has a genetic purpose and a genetic cause. We see this in families. We almost always see, if we see a student, one of the parents has it. If we see a parent, one of the students have it. If you have a sibling, one child, there's a 15% chance higher the other sibling has it. So we often see families with at least one parent and one child have it. And as a parent, you are in this new extra role, not only as a parent, but as a teacher. And you have to get your kids up and you have to get them signed on the computer and make sure they're doing their homework and make sure they're sitting in front of the computer and making sure technology is working, which isn't simple because the whole world's on the internet at the same time now. You have to be consistent when you parent. If you have ADHD, you're inherently not consistent. You not only have to be consistent with yourself, you have to be consistent with your spouse, which is also very hard because you may have opposite traits of them. If you're at work and you're working, whether it's on the internet and in person, this affects your work performance. You have to get your projects done in time. You have to read all your emails. You have to respond to your emails. You have to complete your paperwork. You have to finish things. When you're multitasking and get interrupted. A lot of people with ADD are really good at talking and interacting, but they're very bad at the paperwork and the expense reports and the statistics on things. So even though you might do well initially, over time, it really leads to problems with performance at work. If you're impulsive, you might get in arguments all the time. You may say things without thinking about them. So a lot of people with ADD are very bright, but they don't get promoted at work, and it's hard for them to keep jobs a lot of times. And they often get bored with the job and switch on their own. As an older student, it affects your college achievement. Just getting into college is hard because you have a harder time on the standardized test, although with the testing we do, we can get people accommodations and extra time for that. You have a hard time turning your homework in. You forget to study for your test. You don't finish your test, so your scores are lower. You get really bored. If you're in class and your teacher or professor is kind of boring and monotone, you might have a hard time paying attention. You will have a hard time remembering to turn your assignments in. So it's not unusual that students, whether in elementary school, high school, or college, underachieve. People with ADD get bored easily. They often get bored with their major, and their performance goes down, and they switch majors, or they switch colleges, they switch careers. And most A lot of people do that, but it really interferes with completing college, even completing high school. Believe it or not, we know that 1/3 of students with ADD will not complete high school. But this is really sad. You know why? Because people with ADD usually are brighter than people that don't have it and more creative. But 1/3 of them aren't completing high school. And unfortunately, with our new distance learning, I think that's going to get worse if we have to continue this with our students. Drug and alcohol use is very high with ADHD and ADD. They've estimated 50% of students, especially if they're not treated, they end up self-medicating themselves. We work with lots of young adults that are in drug and alcohol treatment centers. And when they go there and they become sober, they realize that ADHD and ADD might be part of the underlying reason. But to make it more complicated, we see things like anxiety and depression and bipolar and Asperger's that are often there together with ADD. And if you don't do testing, all these symptoms can look the same on the surface, and you could be getting treated for the wrong reason. So hopefully this lets you know why it's so important to get tested. And like I've said a couple times, I like to call ADD interest deficit disorder. So this will affect if you're in school and you have 4 teachers and one teacher's really interested or you like the subject, if you get to do experiments for science, you can get an A in that class. But if another topic might be social studies and you're studying ancient history and it's boring and you can't relate to it, you could get an F in that and get so distracted you fall asleep in class, you start talking, you're disruptive. As an adult, you get bored in relationships, like I said, you get bored in college, you get bored in your jobs. And what's happened in the last 5 or 10 years is when people get bored, they start looking at their phones. And when you look at your phones, you also can't pay attention very well because you're missing visual cues. So anyway, there's a lot of parts of this that interest really is a major factor on. I'm going to talk just 1 or 2 slides about Asperger's. We see a lot of students and adults, especially adults in relationships that have some Asperger's, which is a version of high functioning autism. But it's very, very underdiagnosed because you're bright and you have good verbal skills. It shows up in relationships. It shows up in eye contact. As a matter of fact, I talked to an adult today who is 55, and they're coming in for their first diagnosis of Asperger's, and nobody even mentioned it to them. They grew up back east in a more rural area, and they didn't even know what Asperger's was. They kind of knew what autism was, so it's much more subtle. You might not make good eye contact. You can't read body language, but where it really shows up is in your relationships. So as an adolescent or a high school student, it's very hard for you to make friends. It's hard to have friends the same age. Dating is really, really challenging. It's very hard to express your feelings. It's hard to even understand other people's feelings. In my webinars and seminars on Asperger's, which we have them recorded on our website that you're on now, we actually have adults that say feelings are like a foreign language to me. But if you have Asperger's, about half of people with Asperger's have ADD. But what we see is that they do well in school because they're bright, they're often gifted, and their verbal skills are good. It's when they're not in school, at recess, at lunch, at the school dances if they go, dating, going away to college, and just making friends is really difficult if you have Asperger's. What do students do when they're younger and they have Asperger's and they have ADHD and they can't express their feelings? They have tantrums, and it looks like they're being oppositional, but no ADD treatments are going to help that. As an adult, it shows up in different ways, but it's very frustrating because, especially in a relationship, you can't express your feelings, and your significant other sometimes feels like you don't care. Especially if an adult male has Asperger's and their wife and they're not expressing their feelings, that's very, very important in all relationships. So this is a common occurrence, but there's no medication for Asperger's, which is why it's a co-occurrence. So one of the things I talk a lot about, talked to this client that was in their 50s today coming in for diagnosis, is that why is this still not being diagnosed accurately? Well, it kind of gets back to our healthcare system. Our healthcare system is not developed and was not developed for thorough testing. Our healthcare system is developed for a short-term visit, a 15-minute visit, and a quick short-term treatment. It's not developed for thorough testing. It's not developed for long-term treatment. So especially at the HMOs, whether you think someone has autism or Asperger's or anxiety, they may get one visit for 15 minutes or half an hour, and then at the end of that visit, given a prescription without even knowing the diagnosis and without any tests. It's kind of hard to believe with the technology we have in 2020 that you can go to see a physician and wait a long time to get an appointment and get a prescription and treatment without testing the organ, without testing the brain. It just frustrates me because I've been saying this for more than 25 years now. So why do you have to get tested again? Because think about it, all these things we're talking about, the symptoms can be the same. You can be hyperactive, you can be fidgety, you can get lower grades, you can look like you're not paying attention, you may be anxious, you could be depressed and unmotivated. There could be something going on with all the anxiety with coronavirus right now. ADD has gotten a lot worse because if you're in school now and most of you have to, most of the students have to sit in front of a screen like this and look and do this all day, our brains were not developed for that. We aren't trained to do that. That requires sustained attention all day long without a lot of feedback and sitting in a chair without moving around. That's very hard. And even those of people who don't have ADD get this kind of COVID brain, I call it. And at the end of the day, if you're wearing a mask, we wear masks when we have patients in the office, you kind of feel tired and daydreaming and distracted. And I don't know about you, but I've sure noticed that people are about 2 or 3 times as forgetful as they used to be. So what should we do? We need to do brain testing. We need to test the brain. Schools are having the same issue, and it's even harder now because the school psychologists aren't testing and working with students in person. So this was an old cartoon, was when we actually had kids in school. And this is a kind of a little humorous cartoon about a boy named Johnny who's impulsive, and he always gets in trouble at recess, and the principal says to him, "Johnny, think about what you do before you do it. I've told you that every time you're in here. I don't understand why you can't do it." And if you read what he says, Johnny says, "By the time I think about it, I've already done it." You can see how Johnny feels. He's kind of embarrassed because he can't control it. And if he has ADHD or one of these other things in his brain, no matter how hard he tries, he's not going to be able to control it. He can get better at it. So what the schools need to do and what we need to do is get students tested, whether they're 5 years old or whether you're 55, because that is the first step in the journey. And it's the most important thing to do. So let's talk about what happens and how we do the testing. What I helped develop in the 1990s, which is used all around the world now, is called QEEG, brain mapping. Back then we called it just QEG. Q stands for quantitative, and that's a fancy word for statistics, and EEG are brain waves. Do we all have brain waves? Unless you are in a coma right now, which you wouldn't really be listening, we do. Even though we're tired, we might feel like we can't pay attention. But even when we're sleeping, we have brain waves. So what we've done over the years is done statistics on children from 4 to adults in their 80s, and we've looked at if the brain is too fast or too slow. And using statistics, we've been able to use that to help diagnose different patterns of ADD, different types. and autism and Asperger's and anxiety and depression and head injuries and even dementia. And when we can see it in the brain, then we have the most direct, successful ways to treat your brain. Just like any other field of medicine, you're going to do a test before you do a treatment. You're not going to get heart surgery without doing an EKG or a test in your heart. You could have a panic attack and be nervous and have the same symptoms as a heart attack, and we would know. We wouldn't just go to the hospital and get heart surgery right now, because we know we would expect a test. So it's the same thing now with coronavirus. I mean, you could have symptoms of coronavirus. You could have a sore throat, you could be tired, you could have a cough, you could have all these symptoms, but that's why we have to do the testing, because we're not gonna go to the hospital, we're not gonna try one of these strong medications. If we don't have it, it just might be a cold or allergies. So that's why testing is so important. So the QEEG looks at different parts of the brain to look at to see if there's areas that are fast or slow or abnormal, unstable or disconnected or overconnected. I'm going to show you examples of these now. So I hope this is kind of making sense to you. And I'll remind you at the end of the talk today, Jolie's going to come back and she's going to tell you how you can kind of get scheduled to do this testing. The first step is that we have you set up a meeting with me, a free consultation if you've gone through the seminar webinar tonight. And then we schedule the testing for you because we think it's so important. We don't want you to contact us 10 years in the future and say, you know what, I should have done it then, because now I'm unemployed and I'm divorced, or I had to drop out of school. And I should have had this looked at. And doing this for 30 years, we have that happen frequently. So let's talk about different types of ADD. Some of you maybe don't know that there's different types. Why is that important? Because each type of ADD is treated differently. What does that mean? If you have inattentive ADD, you may benefit from one type of treatment. If you're hyperactive, you may need a different treatment because your brain has a different pattern. If you have ADD with anxiety and you do a treatment that's stimulating, like a medication, you're going to feel worse. You're not going to sleep, you're going to get jittery, and your symptoms may actually get worse. If you have ADD with depression, it's a different pattern. And often you can have multiple patterns. So we need to look at the brain before we treat it. With our neurofeedback and biofeedback techniques, we can individualize in each type of ADD and ADHD. We have different types of treatments for. So let me show you what a brain map is. Some of you may have had these before. Some of you have looked at our website before. So what we're looking at is we're looking at these aspects here. And this is the brain map. And this is like where the nose would be at the top and the ears would be on the sides here. And each of those dots is where we put the electrodes or sensors. We put 19 on the head, and it's not in the head. We put them on the head with a waxy toothpaste. It doesn't hurt. We test children as young as 4 years old and up to adults that are in their 80s. So then you see underneath the circle, you see speed. So the really low speeds, like this says 1.5 to 4, these are called delta. So our brain has speeds. It's kind of like a car. Your car can go too slow, but your car could go too fast. And you want your car in a speed limit, but in a way, our brains, we want to keep them in this optimal speed. We don't want them to be too slow, so we're not distracted and we get our work done, but we don't want them to go too fast because people will be anxious and can't sleep. You want to have your brain balanced, but everyone's brain has a different balance. Every once in a while, this is what quote unquote more typical person, we get someone's brain waves that aren't too slow. It's what we call delta. On the bottom right, we have this speed called theta, and theta is when your brain is going too fast. And then we have a color code. The color code looks like a temperature scale. And if it's kind of the bright colors, like green's average, blue is low, and yellow is a little high, and red is severely high. If you have any bright colors, that shows us there's too much activity, like in the back or the front of the brain at that speed. So let me give you another example of what it would look like if we had somebody who had ADHD. So this one looks different. You see all this red in the front of the brain, and in the front of the brain is where our executive functions are in our frontal lobes. And this is one of the primary areas with certain people with ADD, we find a deficit. If you're, this red means this brain, this person's brain is too much theta. And theta is the speed when it's high. It means that you're daydreaming and you're not paying attention and you're distracted. So the symptoms of that look like attention problems, forgetfulness, distraction, drowsiness. But you could have symptoms of ADHD, but you could have an opposite pattern like this. And instead of the red being at the slow speed, called theta, the red is at this higher speed. And this means your brain's going too fast, but you could have the same symptoms of attention problems, hyperactivity, impulsivity, you're fidgeting, can't do focus at school. But if your brain's going fast, we need to slow your brain down. But we also may need to slow it down in a certain area, like the back of the brain. If your brain's going slow in the front here, we have to activate your brain in the front. You cannot specify how to do this with medications. You can't inject one medicine in the front of your brain and another medicine in your back. It's just not possible with our technology now. So what we do at our centers is we have different types of neurofeedback and biofeedback where we can calm the brain down in certain areas like here where it's too fast. And we can also activate the brain in these frontal areas. And we can do this naturally over time where we get a positive effect, and gradually we get a lasting effect. So that's the real promise of this, is we can individualize it, but we can see these patterns very clearly. Behind these pictures, we get pages and pages, hundreds of pages of statistics and norms. And this has been researched at very good institutions like New York University and Harvard. And we've done some of the research here. So very, very important to be able to do this. Now, like I said, this isn't new. Back in the 90s, we developed this kind of initial version called a QEEG scan, and the FDA approved this 7 years ago. But some of you might be hearing about it for the first time, and it isn't done by physicians. It's usually done by psychologists and specialists. So this is really important. It's not a new test. So when we work with other things like Asperger's or autism, instead of the front, we see deficits on the left and the right side, or we see these other types of pictures. These are called coherent, where we see sometimes the brain is disconnected. This is a different picture where the white is average, blue is low, and orange is high. And you see these little lines that are connecting areas. We want these lines to be white or average. And all these that are blue, especially if they're in the right side of the brain here, this is our social emotional side. This might help us tell the difference between ADD and Asperger's, or see the combination of these. So this is really the key, is doing the right test at the beginning. So I'm hoping this is making sense to you, and I'm gonna kind of switch gears and tell you what we do about it. But our real first goal is to get a good diagnosis and to get an accurate subtype so we know what part of the brain to treat. And then when we do that, we can really specify how to treat, how to work on this, how to improve the symptoms, and we can get good results. So that's what I'm going to go over next as we get into the treatment plan. All right, so what do we do for treatment or how to help this? Because this is biological, it's not due to effort, it's not due to bad parenting, it's worse because of our distance learning now. What we have to do is we need a long-term treatment plan. We call it an action plan now. We have to have a biological treatment that corrects it because this is a biological neurophysiological imbalance we're measuring in EEG. Our goals are different than they were 30, 50 years ago when they developed stimulant medication. Our goals are to resolve treatments long-term and do it without side effects. But medications were developed for short-term use. Medications were developed for temporary effects. They weren't developed for long-term use. They weren't developed, and they also have not been studied for more than a couple years. When we have looked at the research with stimulant medication, which is still the most common treatment for ADD and ADHD, we know that less than 40% of children are successful long-term with medication, and it's even lower with adults, and only 25% of children with ADHD are good responders. What does that mean? They get great results without side effects. Why is it so low? Because they're not matching it to your brain type. They're not individualizing it. They're giving everyone who comes in their office Adderall or Vyvanse or Focalin or Ritalin, irregardless of the cause. But that's the standard in psychiatry right now. The stimulant medications can have temporary benefits, like you drink coffee. They increase your focus, but over time, and even at the end of the day, it decreases your appetite. Your mouth is dry. A lot of people get stomach aches and nausea and headaches. Tics, which are little blinks and jerks or coughs, can be made worse or even caused by medications. You can get very irritable. And there's something called the rebound effect, which a lot of people don't know about. But what that means is at the end of the day, like about this time, when the stimulant medications wear off, people get tired and irritable. It's kind of the analogy I give if you went to a conference and you had free coffee every hour and it was really good Starbucks coffee or something like that, and it was free, and every hour you had a break and you had coffee, and you start at 9 and you end at 5, by about 7 or 8, you're not going to feel that good. Your appetite's going to be messed up. You're going to have a dry mouth. You're going to be irritable. You can't sleep. But it doesn't help. So if your kids are doing your homework or you're doing your college work at night and the medicines wear off, it might be harder than it would have been if you didn't take it. And you're irritable and you're tired, but you may not be able to sleep. The other thing we know is, like I said earlier, they have not studied how this works more than a couple years. In 2009, this is kind of ironic because they're right in the middle of an election. I was speaking right across from the White House in Washington, D.C., and the headline in the morning in the Washington Post said that medications for ADD and stimulant medications after a year were not effective. And the headline was, pharmaceutical companies cover up the ineffectiveness of stimulant medications for ADHD because apparently this data was there a couple years ago. And they had not studied students for more than a year. So some really good universities like Duke and UC Irvine was one of the schools out here, did studies, and they followed students who had ADHD that took medication and didn't, and they followed them over 3 years. So what they found was interesting. After 3 years, the students who had ADD, they had lost an average of 5 pounds more than the students that didn't take stimulants. They were 1 inch shorter, but they were not doing better. A matter of fact, some of them were doing worse. And what they realized is some people can develop a tolerance to medication, which means over time it wears off and it's not as effective. We didn't know that. We didn't know that you might have to change medications. But if you think about caffeine or you think about other things, our brains get used to things and they develop tolerance, and this happens to a lot of medications. Other side effects we see on the stimulant medications are things like stomach pain and insomnia. With adults, you can have high blood pressure and your heart rate's fast. EKGs and a heart monitor test are not required to get a prescription. And in this country, in some countries they are. The biggest complaint I get from parents and students is that the medicine might calm them down, but their parents complain that their kids are like zombies. They're just flat, they're not funny. Adolescents would tell me they feel depressed, they don't feel spontaneous. It might slow them down if they're an athlete. It might give them insomnia. So many students as they get older in high school, and definitely when they go away to college, will stop taking the medicine because they don't like these effects. And the problem is, then your brain is back to where it was, but you've never learned, and your brain has never learned to deal with it. So here's a little kind of humorous cartoon, and it's a very old slide. It was one of my first slides from speaking 30 years ago, so I know it's kind of has a little bit of a tint problem, but let's say this is a child's locker or an adult's closet before and after medication, a stimulant medication. I want to see how many of you can see the difference. I'm going to give you about 30 seconds to see who can see the difference. Well, I always feel a little guilty doing this. There is no difference. The only difference, as if you're on the right medication for your brain type, is when you take it. There's no difference before, there's no different afterwards. So if you don't give it to your student, or a college student stops taking it, or an adolescent stops taking it and tries to sell it to their friends, it doesn't work. And over time, very few people stay on this. Almost no one stays on the same prescription from childhood through adulthood. So many people are walking around with ADHD now that were treated as children. So what should we do for our brain health? I mean, our brains are so important now, and now there's so much more stress and anxiety in the world and so much more media. Matter of fact, if you're like me, the media and the news after 5 or 10 minutes just too much, and it's just different advice every day. So what are the missing pieces for brain health? We need an individualized system and treatment system, and that's how we get the best solutions. What does that involve? That involves activating the brain through different types of neurofeedback. That involves managing stress and anxiety, which is so important with our world the way it is today, with COVID and with all the political turmoil, the racial turmoil, and the national catastrophes that keep happening. So a lot more stress, and just going to school and work on the internet is very stressful. You have to maintain this very high level of tension, and your muscles get tight because you're sitting all day. We need emotional support. We need to understand this. We need to get support. We have support groups for parents and adults that we're now running on the internet that we do every month. But we have to treat the brain or the nervous system. This isn't something that's environmental. It's not something that's due to parenting, but it can dramatically affect your parenting. But as I've talked about over and over, the first step is to test the brain, and that's what we're going to talk about afterwards. How do we test the brain? We do the QEEG brain map and test of attention and test of anxiety and depression. We do them a lot on the weekends, on Saturdays. And we can do this in 2 or 3 hours. It's easy, it doesn't hurt. Like I said, we test kids as young as 4. Why is there so much failure in this type of area? And even with diagnosis, 94% of failure is not due to having a system. And you know what? This is what I think is happening with our country with coronavirus. We didn't have a system. We still don't have a system for testing or treating or who's going to get the vaccines. And look at what's happening. I mean, there's a lot of failure. It's a terrible thing. So what we do, I've kind of developed a brain health system. I call it the Linden brain health system. And what does that comprise of? That comprise of a personalized action plan that combines treatments and technology, because we have the technology now, and our technology, as you know, if you're doing things over the internet and Zoom, how many of us thought we'd be doing webinars instead of seminars and going to church and talking to our family members looking at a computer screen a year ago? So we do different combinations of neurofeedback, which I'm going to explain next, biofeedback, which is relaxation training, counseling and coaching for students and parents and adults and families, direct neurofeedback, which activates the brain for things like depression and ADD and head injuries, and testing. And having a system and starting it leads to the best solutions. So what is neurofeedback? Some of you have heard me talk about it already. Some of you have actually maybe experienced this. Neurofeedback narrows the brain, and feedback is a feedback loop, and you actually get feedback if your brain is going too fast or too slow, or if it needs to be connected, and you use that feedback to train your brain. Again, this is not new. It started in the 60s at UCLA for seizure disorder and epilepsy, and it was so successful that the people in the study were able to get off their seizure medications. Neurofeedback for ADHD was developed by Dr. Lou Barr, who trained at UCLA and went back to University of Tennessee. He was my mentor in the 70s and 80s, and he did 10-year follow-up studies that showed 10 years after the neurofeedback was completed, the results were still 90% successful. We know that neurofeedback is more effective than medication. For ADD and ADHD, the success rate is 80 to 90%. If we do a good brain map like we're talking about, it's closer to 90%. And the studies with neurofeedback for ADD and autism and anxiety, it has the highest benefit to harm ratio of any treatment ever developed. What does that mean? How many people get better versus how many people get a side effect and get worse? And it's like 91 to 1. Because if it's done right, based on your brain testing and your EEG, there really are no side effects. Lots of research. I don't have time to get into the research. That's a whole nother talk. But we have a list of research on our website under resources. And I've done about 15 studies of my own. But let me show you a couple examples of what this looks like. So this is what we would look like in one of our neurofeedback screens. The brain wave, or the EEG, is here at the top. And what the equipment does is it breaks the brain waves into different speeds, and it shows a student as young as 4, an adolescent or adult. It shows you if your brain is going too fast or slow. And we behind the scenes, we put the sensors in the area that needs to be activated in the front or calmed down in the right or connected. But on the surface, you learn to lower your red bar, which is when your brain goes slow for distractions or daydreaming or depression. Lower your red bar, which is if your brain goes too fast for anxiety or over focusing or Asperger's. And raise your green bar, which is the state you want to be in when you're calm and focused, or alert and focused, like the zone we call it. And what happens is that you get these readings and feedback every second. And as you change your behavior and focus and sit still, it's a conditioning feedback loop, and you actually train, or your student trains and heals their own brain. And we do each area enough times where we get a result, and your attention improves and your anxiety improves and you're calmer. And then we get lasting effects because of we're changing the brain physically. So on the right, we might have a movie or an animation. And every time you get your brain calm and focused, there'll be a point. You get a point like in a computer game, and a beep, or you get a movie to play louder. So let me show you what this might look like. If you listen and watch, you can kind of see this change as this person kind of calms their brain down. And let me show you this here. Okay. I think I'm going to show you the one for the movie here. So this is another student, and watch the red and yellow bar, and this is a animation, and watch what happens as he gets calm and focused. So you're hearing the beep. It looks like on the screen that the video isn't progressing, but this video is a roller coaster, and he would be going up and down the roller coaster as he gets his brain calm and focused. Or we might see a screen that has a movie, which could be a movie on DVD or a movie on the internet. And as you focus and are calm, what happens is the movie gets bigger and louder, so you keep the movie playing by training your brain. So it might look something like this. And what's happening on the screen, you may not be able to see it on the video there, is this movie's playing bigger and louder as he's getting calmer and more focused. So he's training his brain by playing a movie. He's not watching the movie, he's playing the movie, and these bars are changing, and we coach people on how to change that. And we coach them on how to learn strategies to do it. And then over time, it heals the brain in those areas. So let's talk a little bit about neurofeedback. And some of you may have heard of it. When I started in this field, and it makes me feel like I've been in this a while, which I have. I was one of the first 4 in the world. And when I started on this field, there was very few people doing it. Now, neurofeedback has become much more common. There's lots of professionals like chiropractors or coaches that are doing this, but it's not easy. You could see how complicated the brain mapping is. It's not complicated to us, but there's over hundreds of patterns I could see in there. Sometimes we see a seizure disorder or something that isn't ADD or anxiety or Asperger's or combinations. So this is something that I've been doing now since 1982. I've been very fortunate. I've got to speak all over the world, in Europe, in Israel, and Australia and China. And we've published lots of research here. We have a neurologist review every EEG, because every once in a while with ADD, and almost with a third of our young autistic kids, we see seizure patterns and abnormal EEGs together with that. We monitor this very frequently. These tests we do, the brain map, we do them at the beginning, but we also do them in the middle and the end. And we do computer tests, and we can monitor how it's working, what we need to change. And I meet with you for these reviews on a regular basis to kind of fine tune the protocols. And they're very individualized. Some centers have started doing neurofeedback in groups, and they'll have multiple people in the same room, or one therapist will be working with 3 or 4 people at the same time. But the analogy I give you is like doing personal training. You do much better with a personal trainer than if you're in the back of a room with 50 people in some sort of group training class. It kind of makes me sad, because my trainer, the gym I went to, closed down, and I'm trying to do the workouts on my own. But I tell you, I am not motivated when I'm tired to go home at night and work out. And without him there saying, good job, do this, now you do this, so you can do it, and encouraging me and helping coach me, I am not working out as much as I could. And I think that leads me to that quarantine, the 15 quarantine, how people are gaining weight, 15 pounds just by being quarantined. And some of it is we can't get individualized training. Every single protocol is individualized, so everyone's brain's different. And we do almost 100 different patterns and combinations of neurofeedback protocols. In spite of that, our fees are very, very competitive and low. And one of the things we're doing with our neurofeedback treatments and biofeedback treatments during COVID is we are offering a significant discount during COVID. And we've extended this through the end of August, which is 25%, just to help out, because we know people are having a hard time and stores are closed and people aren't getting their full unemployment checks anymore. So we're really here to help work this out, because we really want to help people in your brain and your kind of journey be successful. So let me finish up and I'll show you some examples of what happens when you change the brain. This is a student, a college student, that had ADD and anxiety. The red here at this theta speed is his distraction and daydreaming. And the yellow and red at these higher speeds is an anxiety and over-focusing. And he was very bright, but he was very anxious. He would have a hard time on tests. He wouldn't get his homework done. He would have problems sleeping. He would have anxiety attacks all the time. Even when he was in high school, his parents had to go into his room and help him calm down and go to sleep like you might a young child, just to help get him through. We did neurofeedback training. We worked on getting this part of his brain that was slow faster, and the other part of his brain that was fast slower. And after the neurofeedback, you see that red, almost all those patterns had improved. And this is one of the attention tests we do called the IVA. And his weakness wasn't his hyperactivity. These are his attention and speed scores, and they should have been here or even higher because he was very bright. And after the neurofeedback, his attention and speed scores were all normalized. And this was just from the neurofeedback. He went to college, he was successful, his anxiety was better, he could sleep through the night, his test anxiety was improved, and he was a very successful student, and he didn't need help. He was actually able to sleep in his zone without his parents, without anyone else, and without medication. So this is what one of our typical outcomes is. Now, neurofeedback is not a simple thing to do. There's lots of decisions. Sometimes we have people on multiple medications, so you need someone very experienced to do this, and you need a center that's very experienced with testing. There's lots of research with neurofeedback. I found trying to explain the research on the internet and webinars is even more boring than it usually is. So I'm gonna recommend you guys look at our website. There's been about 50 studies with neurofeedback and ADD going back to the 70s. We did some of the studies here at our centers way back in the early 90s, and this is one study. We had a group of students that had ADD that got neurofeedback, they're in green, and another group that did nothing in orange. And this is their IQ, which is usually a measure of your intelligence. Usually IQs don't improve as we get older, but if you don't pay attention, you don't do well on the test. So this was before and after, and our students that did the neurofeedback, their IQs went up by an average of 10 points. And this was 6 months after they were done. The group that didn't do the neurofeedback, they stayed about the same. If you can focus better and pay attention, and you can do better in IQ tests, you do better in school, you do better in your homework, you understand more. This are measures of their attention problems, what we call inattention, higher is worse. And the group in the neurofeedback in green, their inattention or their attention problems went down significantly, as did their hyperactivity problems. Lower is better. And when I looked at these results back in 1992, what we found is that their brain waves and their symptoms looked normal. They did not look like they had ADD or ADHD anymore. Their symptoms were resolved. This was months or a year afterwards without medication. And these are our goals, as I talked about, long-term solutions with no side effects that are individualized. So a couple other options I want to go over to you, and then we're going to kind of wrap up, is we have an accelerated neurofeedback program. We used to just do it in the summer. Most people come in and do this twice a week, but in the summer or in breaks of school, we have people that want to get it done quickly, like let's say if they're here for the summer and they're going back to college. But most of you know that most schools and even colleges are remote. And one of the advantages of the situation now is we have more time. People are home, students are home, parents are home. So it's a lot easier to get the sessions done than if you had to wait till after school and after everyone was done with work. So we usually recommend neurofeedback twice a week, but we can do it as frequently as 5 times a week. And our goal was, this was our goal in the summer, is have students ready to go back to school. But in a way, this is going back to school in person. We're hoping and praying this is going to happen soon. It may happen in September for some schools, it may happen in January, but sooner or later, Our students are going to be back in classrooms with multiple students, especially in college in big rooms where they have to pay attention in a group again, and they have to control their anxiety and their impulsivity. We also developed something a couple years ago called remote training. Remote training means we can do the neurofeedback over the internet. You have to kind of get the brain map done, which we're going to talk about again at the end, how to do that through a testing appointment. And we do the brain map or QEG. I come up with a protocol. You have a couple sessions in our office in Laguna Hills or Encinitas. We get it set up, we get the equipment, and we get an amplifier hooked up to a computer, laptop computer. And then wherever you go with an internet, whether it's in Irvine or it's back east or it's in a different country. I just talked to someone we work with that did the sessions from Asia for a number of months. And then you come back in the middle and you come back at the end and we do retesting and you meet with me and I fine tune the protocols. This is an option also. We've had some people during COVID that have felt more comfortable doing this at home. But we have remained open this time. We're an essential center. We work with epilepsy and autism and anxiety, but we're still practicing social distancing. We're having our patients come in privately from the back door. We walk you in. We're all wearing masks. Our rooms are sanitized between each session. We have these advanced HEPA filters in the hallways and in every office. And we only are working usually with one person at a time. So, but we can do this remotely. And if people end up moving, this is a really good option. Some people end up moving and aren't predicting they're going to move and know that. So what do we talk about? What we talk about, the result of all this is I used to call it a treatment plan, but I call this an action plan because I want people to take action. So what does an action plan involve? There's usually 3 goals of it. The first part is an accurate diagnosis. And 50% of the people we see either are misdiagnosed or have not been diagnosed, even with the technology the way it is. So when you get an accurate diagnosis, your treatment plan is going to be individualized for ADD or autistic spectrum disorder, or anxiety or depression or concussions or head injuries. Our second point to the action plan and for my webinar tonight is that biofeedback and neurofeedback are successful treatments without side effects. And if someone's already on medication, they can reduce or eliminate medications. And that's a really important goal, right? The third goal is the other part is we have to resolve symptoms long-term. And neurofeedback and biofeedback in numerous studies, if it's done the right way and it's based on individualized testing and monitoring, are successful long-term brain-based solutions. They're not based on symptoms, they're based on your brain patterns and how they're changing, and they're directly reinforcing or healing or conditioning the brain. So I really can't go over a lot of examples because what we do is very personal, confidential, but I do have a parent who actually has asked me to talk about what happened with her son. And if you go to our website, there's a TV show called The Doctors, which was on CBS that we were on about 10 years ago. And we had a boy who was 8, his name was Noah. And this is the typical thing we see. He came in to see me. He had been on 3 different medicines. First, the doctor thought he had ADHD and they put him on a stimulant. And he became worse and got aggressive. Then they thought he had Asperger's and they put him on Risperdal, which is one of these newer antipsychotic medications. And he got really sedated and gained weight. He was calmer, but he couldn't focus. He would sleep all the time. So he came in, we tested him, and you know what we found? We did find he had ADHD, and we did find he had Asperger's, but he had a seizure disorder, and nobody had tested his brain. Then he went to a neurologist, and the neurologist put him on a seizure medication. His seizure patterns were temporarily normalized, but he couldn't pay attention again. So his mom came back and said, you know what, I'm tired of this. He's only 8 years old. He's been on 3 medicines. He's lost a whole year of school. So we did the neurofeedback and he started to improve and he was calmer and he paid attention better and he didn't get in trouble and he was off his medications and his seizures normalized and his patterns in his brain normalized. So this is what she wrote to me 10 years later. that she wants me to share with people. We met about 10 years ago. I remember the terror my son was. He was impulsive and had an outburst. I was at my wit's end. Now my son has become a completely different kid. He's the same son, but with a different attitude and behavior. He actually won the award for most outstanding student at his school in Oceanside back then. One teacher who worked with him for 3 years could not believe the improvements after the neurofeedback therapy. You gave me my life back after the treatment. What you do literally changes lives, and thank you once again for all your help. This is our goal. This is what we hear frequently. And this is what I want to leave you with hope, is that there are long-term treatments, but you have to get the right testing. So here's my last question to you. Can you predict the health of your brain? Some people would say no. I think the answer, and I know the answer is yes, because we can test our brain. We can do these attention tests. We can do the brain map, the QEEG, and we can see these patterns, but we can also normalize them and improve them. In order to do that, you have to take action and find a solution. Unfortunately, as we get older, our brains don't get better. And once we hit a certain age, our memory is worse and our anxiety is worse and our sleep is worse. So it's always better to do it now than later. As I said earlier, it's kind of a no-brainer to test your brain. What happens if you don't? School dropout. A third of kids with ADD, even if they're bright, they drop out of school. Half won't complete college. 50% of untreated and undiagnosed students with ADHD use drugs and alcohol, particularly nowadays marijuana and stimulants. Most of the students with ADD, even though they're bright, won't get through college. They have a hard time holding a job. They have a hard time getting a job. It's pretty hard nowadays to get a job, especially if you show up late for your interview and you don't follow up with the references. They have a tremendous difficulty in relationships, having relationships, keeping relationships, communicating in violence. One of the things we know is that students that have undiagnosed and treated ADD or other things like Asperger's or anxiety, they end up having more violent episodes. Sometimes they're involved in these school shootings and violent shootings. And I really have a theory that a lot of the violence in our society today is due to all the stress that's building up, but it's also due to a lot of people who have undiagnosed ADHD that are saying and doing impulsive things without really thinking them through and being patient. With certain fields, like in the head injury, if you have too many head injuries, it can lead to death. So we need to focus on the true underlying cause, looking at the EEG, not the symptoms. We have to correct the brain dysfunction, not temporarily, but long-term, not temporarily just with medications. And we have to have an individualized approach because everyone's brain is different, everyone's family is different, everyone's environment is different. And during COVID, there's a lot more stress on our brains and a lot more uncertainty, a lot more overload. And doing things like parenting and social support and social skills are really good adjuncts. And I have webinars on parenting, and we have information about schools. We're going to talk about accommodations and a talk next month in social skills. But I just hope as part of listening to this that it helps you decide to take charge and get help now, because the most frustrating thing to me is to see people 10 or 15 years later and find out they didn't do anything, or they did one thing and stopped because they got a side effect and things got a lot worse. So what is the solution? We need to take action now. Don't wait till it's too late. And I'm very optimistic about this because it's never too late to find your dreams. A lot of us have time to think about what we want to do with our lives now because we're kind of stuck at home. And I've been doing this for 35 years. The thing that keeps me going, doing this so long, is I've seen the difference in my patients, and I've seen my family members. I've seen family members that were diagnosed with ADD and they have autism get the right treatments, get the right diagnosis, and become very successful. So I just hope this gives you a lot of optimism and motivation to make a decision and get testing and look into this. I hope this is helpful. I hope this has given you information and some encouragement and some hope in a world that's kind of seems hopeless right now, because this is an opportunity we have where there's a little lull in certain things to really help our students and assess their brain and help their brains so they can be more successful. Because at some point, things are going to start back up to more normal and we have to go to school and work in person. And I think everyone's going to be behind and stressed because of everything that was missed. So I just hope that this has been helpful. Feel free to contact us if you have questions. Thanks again, and we'll look forward to talking with you soon. Bye.